interesting thing I'm kind of noticing in people as of late, and it lends to why you persistently get pinching or a stretch feeling or a pull sensation in the creases of your hip joint. And that aspect is, yes, I'm teaching pelvis neutral, so you won't throw yourself into this arch position when you go back. So first thing is, don't learn to stabilize like this the heavier you go, or the heavier you go when you want to pick up something or you're working out or whatever it is, gardening, yard work, okay? So that's the pelvis neutral we've done. However, a lot of people can achieve this pelvis neutral and they still overlock up here. And the only reason why that matters to do an extension piece from above the pelvis, right? So this is up here. We were talking down here, now we're talking up here. If you're going past a seated position's generally about 95 to 100 degrees maybe of flexion, right, of your spine or of your hip joint and spine. Once you get past that amount, what I'm noticing is that, so say you're gonna put your pants on, you're gonna squat lower, you're gonna deadlift, you're gonna pick something up off the floor. If you keep this pattern of locking here and you're trying to bring your hip up to you, that doesn't work. You don't keep this extended when you're trying to fold. I can already feel stress in this particular region. Once you get past 95, let it go. You have to think you're gonna go into a ball, let it go. Because that gives you the ability to posteriorly rotate this innominate. You're not stuck through here, you can go this way. So after 95, you do need to fold, 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 fold past that point, because that is the mechanics to get past that degree of flexion. The more you stay stuck like this, you can't fully fold, you'll cheat, you'll stress here, and you'll even develop a side bend type of compensation. And if you have one hip more stuck than the other and you're compensating, you're gonna really start seeing this scoliosis where you go in this way, so now your right back is in, your left back rotates out, and you're gonna start creating a mechanical scoliosis that can be really hard to get your deep muscles to let go of so that you can go back to neutral. So remember, if you're flexing and folding, so that's squats, lunges, deadlifts, picking stuff off the floor, every time you put your pants on and off, even some chairs and couches when you fold, let go of this sensation here. And you will have to look in a mirror because you think that you're letting go, but you're still stuck, and you gotta drop and you actually go into flexion. And then look to see, if you do this, do you do that? Or can you actually lift your leg without compensating through the spine? You can just pick it up.